You're watching TV-20 News 530 Live with Paige Beck and David Snyder. This is TV-20 News in high definition.
He battled the giants of the National Hockey League, but NHL player Rick Rippon could not battle depression and apparently committed suicide a week ago. For millions of people, depression is a murky, endless maze of confusion and pain. David finds out what sufferers and their loved ones can do about it in tonight's Medical Spotlight.
Thank you, Paige. Here tonight with us is Dr. Elias Sarkis. He's founder of the Sarkis Clinical Trials in Gainesville. What is the latest we know, Dr. Sarkis, about the causes of depression?
Well, that's a very good question, because the latest is that there's a lot of different causes of depression. Genetics play a role in it, so people are more or less susceptible. Early environment plays a huge role. So there's a study that just came out yesterday showing that the child of a depressed mom is more likely to have a larger amygdala. That's a part of the brain that's very sensitive to stress. And then, as we just saw, people that get hit in the heads and they have serious head injuries, for example, can develop depression, and those are a little bit more difficult to treat. So that you've got a whole bunch of different things: genetics, early environment, current environment, some physical injuries, medical causes.
In your work in research, medical research, how do you research depression? Do you go by anecdotal incidents, or do you actually do further, deeper studies?
Well, we really have some very strict criteria, and they're revising the criteria right now, but we've got some based on new data, but we've got some very strict criteria of how long somebody's been depressed in order to call a major depression, or there could be dysthymic disorder. So there are a lot of different classes of depression that we look at. And we also look at rating scales and all sorts of symptoms to see how depressed the person is. If the depression is affecting their sleep, their appetite, their energy level, if it's affecting their thinking, their motivation. One of the big things is their enjoyment of life. A lot of times, somebody, maybe the only sign they have of depression is just they're not enjoying things, but then when you look a little bit further, you'll find more signs of depression.
You talked about some of the causes, some of the sources, I guess, of depression. Could it be said that there are triggers that cause bouts of depression as well?
Well, it's interesting. One person I saw today is, it's what we call an anniversary reaction. So a couple of years ago, something really bad happened in her life, and today she's just crashed, and she didn't know what it was. And I went probing and found out that there was an anniversary of a death a couple of years ago, and it's coming up. So sometimes there are those triggers. Sometimes after a certain point, depression sort of lives on its own.
Once depression is actually diagnosed, is medication the only way to treat it, or the best way to treat it, or where does that stand in the terms of treatment regimen?
Boy, we've got that's one of the good things about doing research. We've got a wide range of treatments for some mild depression. Some exercise and talking helps. Psychotherapy helps. We've got even psychotherapy. We've gotten a lot of research in psychotherapy, which is very focused to improve depression. Medications. We've got newer medications with fewer side effects. Combining psychotherapy and medication seems to be very, very good. And we've always had ECT for a long time, which is electroshock therapy. But now we've got a new type of therapy with a lot less side effects called RTMS, which is basically a magnet that sort of normalizes the electrical brain stimulation.
Wow, interesting stuff. And we're out of time, unfortunately, but thank you for these insights, Dr. Elias Sarkis.
Thank you very much.
Okay, Paige, back to you.